helping make your life easier. Moms Every Day.
Food allergies are often misunderstood, and sometimes the information out there can be scary. Allergist Petra Razdan is here to talk about some of the myths surrounding food allergies. Always nice to see you.
Nice to see you too.
So, what are we talking about when we discuss food allergies?
You know, food allergies are quite common and prevalent in the world right now, and that is if you consume the food and you have an allergic reaction. It can be vomiting, hives, or swelling, shortness of breath if it's really severe. And a lot of times children come in after consuming the food the first time and they have like hives around their mouth and things like that. Very common is milk, eggs, wheats, or peanuts that have been introduced.
And should you be tested then?
Absolutely. I think it's good to confirm that it is a food allergy and also to see whether other food should be introduced at a later date. And also if there's a family history, that will point us in the direction that there's clearly atopy in the child.
You hear a lot about gluten. Is that a food allergy then?
So gluten is a protein that's present in wheat, barley, and rye, and that is an intolerance. A lot of people come in and they say, well, every time I eat wheat, I have stomach pain, I develop diarrhea, sometimes constipation, but that is more of an intolerance. We can deal with a wheat allergy per se, but you need to see a gastroenterologist to be diagnosed with then called celiac disease.
Oh, really? Okay. Food allergies, severe ones, how do you treat them?
So a lot of times people think that you can give antihistamines because you're thinking it's histamines are released, let's give that. Well, that will treat that severe allergic reaction, also known as anaphylaxis. So you should know that antihistamines will only treat the skin condition known as hives, nothing internally like the wheezing or closing of the throat and such things. You always need to use your EpiPen. If you then have used your EpiPen, you need to present to the ER for further evaluation and then come and see an allergist to find out what happened.
What if your child is younger than 3? Can they be treated?
Absolutely. You know, there's no lower limit or upper limit for skin testing or blood testing. I see a lot of children that are just a couple of months old and then eating their first food and they have problems. And we just have to kind of limit what we put on their back because they're so small.
What if your child has an egg allergy? Can they get the flu vaccine?
You know, there's a little bit of controversy there. So according to the Academy of Allergy, Asthma and Immunology in our college, absolutely. Recent studies have shown that it doesn't matter how severe of an egg allergy you had, you can still get it. But the committee that advises the CDC feel that if you had a severe allergy, that's better to be given in an allergist's office and then wait for 30 minutes. But most people should safely be able to get the flu shot even if they have an egg allergy.
Okay, good to know. A lot of information. Thank you.
Thank you.
Yeah, and for more information on allergy, asthma, and immunology associates, visit momseveryday.com or download the Moms Everyday app.
Visit Moms Every Day online or on the go through our Moms Every Day app. Download it today to find local solutions for you and your family.